Hello, Dr. Christopher Killingsworth here. Welcome to your pre-op. Now we're going to show you this video at some point in your visit today, but I do intend on seeing you and answering all questions. We'll review the risks, benefits, and alternatives of surgery. A few things to talk about in general is that surgery is not risk-free. There is always a risk with surgery. However, in this type of surgery, the risks are very, very low. Bleeding and infection are always a risk of any type of surgery. A bleeding risk is about 2%, infection risk is about 2%. I want those to be 0%, and we do everything we can to make it 0%. However, I can't tell you 0%. So if bleeding were to occur, that's something that we would need to fix, most likely with an operation. Infection is super rare, but if it does happen, most of the time we can address that with antibiotics or procedures that are just dealt with in the office. Some other risks that can occur are where the incisions don't heal well. Usually we're able to take care of that with just a dressing for 1 to 2 weeks, and that gets better on its own. Very rarely we have to cut that area out and put it back together here in the office. Other things that can happen, especially with our tummy tuck patients, are DVTs or blood clots in your legs. We do things before, during, and after to prevent that. We also put you on a blood thinner after the operation to reduce your risk of DVTs. The DVT risk alone without the blood thinner post-op is about 2%. If we do use the blood thinner, it's about 1% or so, so we really reduce that in half. So we most of the time will recommend we use that in a post-operative setting. Some other things that can happen that are pretty rare as well are seromas. That's where fluid collects underneath the skin. That can be dealt with in the office, either with aspiration or sometimes we have to open the incision a little bit. Again, those risks are very low, around 2-3%. Now, if you're having an operation with implants, we do have to talk about that. There are a couple things to know. Obviously, breast implants don't last forever. If you have silicone implants, we need to exchange them in about 12 to 15 years. That just avoids a time frame where the implants become less reliable. Other things that can happen with implants are capsular contracture. That's like where the capsule itself becomes hardened. We think we know why that happens, and we take steps to avoid it in the operating room, such as using a no-touch technique and antibiotics to avoid any bacterial contamination during the process. But that being said, the risk is about 7% over the lifetime of the implant. If it does occur, we can address it with an operation and/or medications to slow the progress. Another thing that can happen with implants, and you may have read about this if you've been doing some Googling, is what's called breast implant associated ALCL. That's a lymphoma associated with breast implants. One key thing to know is that they're associated with textured implants, which we do not use. So the implants that we use don't have a risk for that. The other thing about breast implants is breast implant illness. We've done studies. The FDA took implants off the market in the 1990s and really studied silicone implants. People were complaining of symptoms of brain fog and fatigue, and so obviously we wanted to make sure that implants were not causing those symptoms. And the results of a very long, approximately 10-year study were that breast implants had no causal relationship with those symptoms. We're not saying that people don't have the symptoms, we're just saying there's no causal relationship between the implants and those symptoms. However, if there was ever a concern about that, we could always remove the implants. There are a few other risks we need to go over, but these are the major areas. Again, I will be coming in and talking to you about your case individually and specifically. So I hope you have a good pre-op visit, and I'll see you soon.